Amid rising Omicron concerns, India has reported 3 fresh cases of the new variant, taking the tally to 5. Fifth case detected in Delhi. Patient is a Tanzania returnee and has been admitted to the LNJP hospital in Delhi. 2 other cases reported from Gujarat and Maharashtra respectively. Karnataka clearly on a high alert. It was the first to report the 2 cases of the new variant. Municipal body BBMP has traced all 10 international passengers who, remember, had come from South Africa and gone untraceable after their arrival in Bengaluru on 20th November. Meanwhile, Union Health Ministry has written to the state governments and union territories asking them to take necessary steps to prevent the transmission of the mutated virus. States and union territories have been asked to test, track and treat to stop the spread of the virus. Now, Health Ministry's move comes after weekly positivity and the death rate has witnessed a sudden rise in the few states. Health Ministry has asked the state and union territories to check international travellers thoroughly and monitor emerging hotspots.
ये पेशेंट हमारे पास 2 तारीख को आया था इंटरनेशनल एयरपोर्ट दिल्ली से और 2 तारीख के बाद इसका हमने टेस्ट किया। पहले ही RT-PCR टेस्ट कराया हमने क्योंकि पहले इसका रेट पॉजिटिव था, तो दोबारा हमने RT-PCR करके और उसका जीन सीक्वेंसिंग के लिए सैंपल भेजा था जो पॉजिटिव आया है। आज ही पॉजिटिव आया है। बाकी लोगों के नेगेटिव आए हैं, उनके कॉन्टैक्ट्स हैं जो कि सभी लोकनायक में आइसोलेशन वार्ड में भर्ती हैं। ये जो पेशेंट्स है इसको हमने अलग रूम में रखा हुआ है पहले से ही, क्योंकि ये तंजानिया से था, अफ्रीकन कंट्रीज थे, तो हमने पहले से ही इसको अलग रूम दिया हुआ था।
ओमिक्रॉन एयरपोर्ट पर जो भी लोग आ रहे हैं अफेक्टेड कंट्री से, जितने भी लोग हैं उनका सबका टेस्ट किया जा रहा है एयरपोर्ट के ऊपर। तो अभी तक 17 पॉजिटिव पेशेंट्स LNJP में भर्ती किए गए हैं। 17 जो पॉजिटिव हैं उसमें जीनोम सीक्वेंसिंग कराई गई, तो अभी तक 12 लोगों की जीनोम सीक्वेंसिंग की हो चुकी है और एक उसमें से जो है ओमिक्रॉन का पेशेंट लगता है कि जो तंजानिया से आया है, तो उसके प्रिलिमिनरी रिपोर्ट के अंदर वो पॉजिटिव हैं ओमिक्रॉन से। फिर भी जो लैब से फाइनल रिपोर्ट इशू की जाएगी वो कल की जाएगी।
India's 4th Omicron variant of COVID-19 case is found in Maharashtra, which is very near to Mumbai in Dombivli area. The 33-year-old passenger came from South Africa's Cape Town via Dubai and Delhi to Mumbai. When his COVID-19 test was done, he was found positive. The further investigation found the Omicron variant in the COVID-19 test. Now, a total of 13 high-risk contacts were traced and another 22 low-risk contacts were traced, and all were found to be tested negative for COVID-19. Very importantly, there were 25 people along with this particular person who travelled from Delhi to Mumbai. All were traced out and all were found tested negative for COVID-19. More contact tracing is being done by the officials. With camera person Hemant, this is Saurav Aktania in Mumbai for India Today.
So here's now a status check of the Omicron cases in the country presently. Now first, remember latest is from the national capital, Delhi. It's a Tanzania returnee testing positive from the Omicron variant, which after the genome sequencing is confirmed. Patient has been currently admitted to the LNJP hospital, which is a COVID-specific hospital in Delhi. Karnataka, where the first 66-year-old foreigner had been tested positive from South Africa. He arrived in Bengaluru from South Africa and that was in end of November. 24 primary contacts and 24 secondary contacts were also traced, but all of that, it appeared, was under control. In Karnataka, remember, this individual, the first case of 66-year-old, left India and has travelled to Dubai. So he's out of the country after recovery. And in Karnataka, again, remember, another case was of 46-year-old who was a health worker. And interestingly, both cases in Karnataka were independent of each other. And this one, the 46-year-old, had no travel history. So how did he contact Omicron is being investigated. 13 primary contacts and 205 secondary contacts were also then contact tracing was done. In Gujarat, which is again a recent case, 72-year-old testing positive and has now been admitted in a hospital. He arrived in Gujarat's Jamnagar from Zimbabwe on 2nd of December. So African nations will be certainly put on an alert. Patient, interestingly, was fully vaccinated when he arrived from Zimbabwe to Gujarat. And in Maharashtra, was a 33-year-old. The latest case that we just heard about arrived from South Africa again on 24th of November. And currently he is a resident of Dombivli in Mumbai. And that is an important point, that he was unvaccinated. So these are, remember, it's not just about the African countries, but all the state governments have been told to be on high alert. Interestingly, and all of this, remember, to give you a focus of what precisely is the situation with regard to these cases that are coming in from Africa and from other countries as well, to ensure that this time we do not see an impending third wave that many experts have cautioned about, but we focus at this point on what can be done. So here's the FAQ. Does illness involve emergency oxygen needs? The answer to that, according to our experts, is no cases so far of the Omicron has needed an oxygen support. So do you need to worry about stocking oxygen cylinders that we saw in the second wave? Government has said that oxygen shortage lessons have been learned, so don't go across right now suddenly buying oxygen cylinders. Again, another FAQ. Could the Omicron grow into a second wave-like disaster? Many are thinking about that. To us, the answers from experts in the government is that possibly in numbers, it may return, but unlikely in fatalities, because the government can look prepared this time. By when will the Omicron nature become clear? Studies are currently on, and the clarity could come in the next 2 weeks on the Omicron variant. Importantly, should you worry about the medicine availability, all of our nightmares from second wave coming back again this time, to which the government has said medicine shortage hopefully will not be repeated this time. Preparations are currently underway. Should you worry about a hospital bed availability this time of the Omicron variant if it increases? According to the government, both in centre and the state, worst case preparations are currently in force. Government has said, don't panic. That's what we are hearing, don't panic. But the fact is, I'm already panicking, and many watching this show as well could be. The answer to that is, it is natural to feel concerned and panic. But that is why you need to watch India Today, where we bring you verified, confirmed information on Omicron. Let's now move on from that. Omicron cases are being detected in India, that is a fact. But the debate on the need for a third booster dose has also reignited. So while health experts have suggested there needs to be a third jab, apart from the 2 that most of us have already taken, but for people with weaker immunities, the government has said they are reviewing the need for the third dose. Here's more on the story of whether there needs to be a booster jab that we will now have to get. Take a look.
Know that the virus has infected people who have received 2 doses of vaccine. We even know from the Israeli case that there is a person who had received a booster dose of a Pfizer vaccine, therefore 3 doses of vaccine, and still got infected. So we need much more clinical information.
There is a need, and the time is now. That is the word from India's top vaccinologists, doctors, health experts on the third dose or the additional dose for those with poor immunity that may be severely compromised. At a time when the world has been confronted with the 5th variant of concern, Omicron, and India is unspared, there is a growing demand for boosters in India, hoping it would offer further protection to those with compromised immunity. The government so far has said they are studying the need for the additional dose.
बूस्टर डोज के लिए इसके इम्पेरेटिव्स क्या हैं, ये सारा अध्ययन, जब मैंने कहा कि हम जो वैज्ञानिक पहलू हैं इसके, उसको बहुत ध्यान से स्टडी कर रहे हैं, इसके ऊपर पूरी नज़र है. It's an ongoing work.
But the world is in a fix, say experts, and we can't wait, as vaccine hesitancy or complacency is also setting in.
There are some concerns for India. Number one, there has been a vaccine hesitancy growing over past 1 month. And rather than having at least 1 crore vaccination per day, we are having 50-60 lakh per day. So we need to escalate vaccination. Number two, we do not know whether this vaccine will protect this variant or not. And therefore, we need to have newer research and see that this variant is also covered in the vaccination program.
The efficacy is dipping down even to 34 to 44%. Therefore, the urgent need of a third dose, which is now being called as a booster dose, but should be a part of the primary immunization. I think the boosters are extremely important in India. We should have a plan, especially for the healthcare workers, the vulnerable and the elderly with comorbids.
The focus, however, of the government is on the second dose coverage. INSAGOG, the consortium of labs undertaking genomic sequencing, has said that vaccination of all remaining unvaccinated at-risk people and consideration of a booster dose for those 40 years of age and above, first targeting the most high-risk, high-exposure may be considered, since low levels of neutralizing antibodies from current vaccines are unlikely to be sufficient to neutralize Omicron. The risk of severe disease is still likely to be reduced. Sources within the National Technical Advisory Group on Immunization say that they're deliberating on the matter. But just yet, there is little clarity on when the concrete set of proposals for the additional dose or the third dose will be finalized. In New Delhi, Sneha Mordani for India Today.
My colleague Sneha Mordani will also now explain some of the symptoms of the new Omicron variant of COVID-19 and are they different from the Delta variant? Here's what you need to know.
Many people are asking the question on whether the symptoms of those patients infected with coronavirus this time around, infected with a new variant of Omicron, is any different from the symptoms that the previous patients had shown who were not infected with Omicron. The answer to that is a big yes. The symptoms are indeed different. What are the new symptoms then? Tiredness, scratchy throat, mild muscle ache and dry cough seem to be the symptoms of Omicron right now. The old symptoms of loss of smell, taste and cough is not being seen in patients who are being detected with the Omicron variant. Will RT-PCR tests help diagnosis? Yes, says the World Health Organization. Yes is the answer from the Indian Council of Medical Research as well. Does it cause more severe disease? WHO says that we do not know just yet if the Omicron variant causes more severe infection. Does it cause more infections? WHO says it's unclear, but it appears right now from whatever evidence is there that it indeed is causing more infections.